The agenda says Joe Ronan is up here. Unfortunately, I got a call this morning from Daniel that said Joe left a message last night that he had to go home for a family emergency. So he is not up there. What Daniel asked me to do is give a summary of what is going on in Montgomery County, Pennsylvania, and the project we're working on. I'm the project lead and probably the best position to represent that. Richard Gold is not here because he got called to some state meetings, and he's on the agenda also. He's the state child welfare, family and youth director. So Scott's going to represent not only IT but some of the state interests. So we're going to two-time that. The good news about Joe, by the way, is I got a message a few minutes ago that Joe got a frantic call from his wife last night that her father had chest pains and was rushed to the hospital. The good news is that he was diagnosed. It wasn't a heart attack. They're not sure what it was, but he's being released today, and so all things are good. And he apologizes for not being here, but it was the appropriate thing for him to do to go provide comfort to his wife and check in on his father-in-law. I cannot match Joe's passion, our fervor, our zeal. If you get to know Joe, he talks from the heart. He understands the business, has been part of this. He's very committed to providing services to those in need. What I can share, though, is some of what the activities we're doing and the scope of it, what we're all about, and how that project is going. We're near completion of it. We've been at it for 6 or 9 months now, and we're at the final stages of completing the documentation and the recommendations, and I can share some of the components of that and what that's all about. Montgomery County, Pennsylvania is a little under 1 million people. It's a rural and urban county. It's outside Philadelphia. It's not got the large city problems, but it does have many of the ills. I think in some respects it does mirror Montgomery County, Maryland in some respects. Joe is head of the Human Services Administration as the organization. It is a health and human services organization. He's got all the various different agencies under him, and I can't name them all, but he could better represent that. But I think it's very common to a lot of the structures. The county, Pennsylvania does have a county-administered, state-funded model. There are some state functions in each county that provide some of the income support, but for the most part, things like child welfare and mental health and drug and health services, public safety, or not public safety, that's another organization, but those are all components of Joe's organization. We got called in, there was a conversation started about 2 years ago, I guess, or somewhere around that time, where we got called into a meeting at the University of Pennsylvania. Professor Dean Gellis, Dean Richard Gellis, the head of Social Services Policy and Practice at the University of Pennsylvania, brought in a number of different people and organizations together. I think the most poignant moment for me in that meeting was when he shared that he's been working in this world of human services and social services, child welfare, for 4 decades, and he refuses to work a 5th decade without trying to find some way to change things and make things improve and make it for the better. And so he had gathered around representatives from UPenn, the Field Center, Debbie Schilling-Wolf, that talked yesterday. The Field Center was involved at it. He also brought people from the Commonwealth of Pennsylvania, the state organizations, like Richard Gold in, and he also brought in Montgomery County. And his model was, I want to make some changes. He asked us to come in from Steward to Change. He says, you guys offer some hope with what you're doing at the conferences and the conversations you're having and the affiliations you have, like we all have here. You offer the best hope of trying to make some change, so let's see what we could do to come together. Out of those conversations evolved a project where we have come in earlier in 2009. We came in and kicked off a project. Joe calls it, his desire is to create information portability. Every county has a different model. Joe calls it information portability. How do we start sharing information across the organizations? How do we start looking at things on an integrated basis? How do we start looking at things holistically? So all the reasons that Mary talked about or Uma talked about, we can bring together and look at more collectively, more integrated, and solve the problem instead of all these individual silos. So coming at it different, a little different nomenclature, but all in the same models of what we're working with that as Mary and Uma have talked about. So we had this collaboration between UPenn, the Field Center, the Commonwealth, and Montgomery County. We also brought in a number of partners that I'll share later in this project. But for the most part, what we did is our model basically is this is not one issue that needs to be solved. It's not a technology-only issue. It's not an organization-only issue. It's not a confidentiality issue. It's a collection of a whole lot of things. And so what we really did is put together a project that if you look at your conference, if you look at the interoperability handbook, for the most part that summarizes what we accomplished and what we were trying to do, what we have done in Montgomery County, Pennsylvania. Let me go through some of the components of it. We had the normal project management that we do weekly and monthly check-ins. We have multiple meetings. We have project schedules, all the things you do in any large complicated project. One of the first things we started was the change vision process. Joe was very astute at saying, okay, what's the collection of people I want to get together in order to determine what my vision is going to be in 2015? We use that as a target. It could be 5 years. It could be 6 years. We selected 2015. In a process of going through who are the major stakeholders, we came up with about 40 or 45 people that we had a 2-day vision process, change vision process. The stakeholders were not only in Joe's organization, but he took a very comprehensive look at it. So who are the child and parent advocates, representatives from education, representatives from foundations, representatives from the state, other community organizations. So it was a very holistic approach. And we spent 2 days building what is the vision that Human Services in Montgomery County, Pennsylvania, Health and Human Services wants to look like in 2015. That many of the components that Uma talked about, one of my favorites always is, as Uma's is tell my story once. Because if you look at Human Services, one of the things that goes on is the need for a client or a customer to tell their story continuously over and over and over and over again. Not only across different programs, but as Uma shared, we find examples of 20 times within even one program, how many times a customer might have to tell their story. So again, it's the component of, you've seen some of the vision maps. Uma's vision map is in the back corner out there. There's another interoperability roadmap that we built for Joe's. It's in the example in the farm room as well. So we built a vision map and trying to determine what is the vision that Joe and his team wants to be in the year 2015. We did some organizational assessments, what we called readiness assessment. We used what we determined as the 10 business drivers. What are the 10 most important things in order to create change in an organization to get to interoperability? Those business drivers, we did assessments through a survey of all of Joe's people and some other organizations within the Touch with Joe. We also did interviews, not only within Joe's organization, but outside of Joe's organization, including judges, including education leaders, including community leaders, and so on. Again, a very large, comprehensive approach. One of the critical factors that we've talked a lot about yesterday was confidentiality. And so we partnered with UPenn to not only do an assessment of what are organizations, what are states, what are counties doing with respect to confidentiality and getting past the barrier that says I can't do anything and determine what it is you can do and how confidentiality and the HIPAA laws and the FERPA laws, how they could become enablers, not disablers, not barriers, but enablers to how we accomplish information sharing across organizations. We did that research ourselves, as well as we also partnered with UPenn. And so Professor Alan Lerner from the Pennsylvania Law School, he did extensive research not only on the federal laws, but also you have that slice of Pennsylvania law that also comes into play on all of those laws as well. Obviously, we baseline what the business processes are. So we had an as-is business process. The major processes within the organization of Joe's, within the framework of what we looked at. We not only did the as-is, but we also did the to-be. So once we had documented and identified the as-is process, what are the to-be processes? What are the things that can change, that can be improved? What are the barriers? What are the things not only we come to the table with and the collective view that we all have from these conferences, but what are even the workers? What do the workers say that how changes and improvements could be made? And so we have documented that and come up with as-is and to-be processes, business processes. We did a survey of all the stakeholders, not only the stakeholders within the organization, but who do they all touch? Who do these organizations all touch? And so we had concentric circles about who they touch from a matter of who are the most important ones versus the frequency of stakeholders that we work with, and we mapped that out. And out of that, then, we even built a social network that dealt with all the different lines and all the different places that people are touched. And with the use of Visio, you were able to create one overall map that had lines going everywhere, a real mishmash of everything, and then you could get it down to gradients of individual organizations and individual functions, and even who talks to who and how often do they do it. Is it a strong relationship? Is it a frequent relationship? Is it an infrequent relationship? Obviously, nothing happens without looking at technology and how do we make technology an enabler. So we also have done an extensive study of what is the as-is state of technology. We also created what is the to-be state, as in what's the architecture, overall architecture that you would want for that organization. And finally, the third component of technology is we're building an implementation plan. Given where they are now, given where a model architecture, given where they want to be from a business process, all the issues of confidentiality and organization, what are the technology components that you need to build to enable all of those things you want to accomplish? And so that became, all those became components to it, and now we're in the process of synthesizing, creating an overall plan that we've called a roadmap. What is the overall roadmap? Taking a look at all those assessments, all those recommendations, whether they be confidentiality recommendations and changes, business process ones, organizational assessment, or technology. What is the overall roadmap that says, okay, how do I get from where I'm at now, and how do I get what I call the journey? How do you get on that journey to get to ultimately interoperability? So that's where we're at right now. We are on that finalization of the project. We will give them a roadmap of what we think it will take to get on that journey. Obviously, a critical part is then how do you engage? Where's the funding in order to, you do have to invest some to make change. So we're looking at funding mechanisms as well to provide what Joe can do, what Joe and his team can do, and how we can work cooperatively with the state. Obviously, that's an important component, and we even deal with some of the federal issues, some of the stimulus funding, and how to get there. So we're looking at that as well. Now, we've accomplished that, and we're finishing that up. I do want to note that there are some critical players we brought in together on the team. And Debbie in her discussion yesterday, mentioned some of them. We brought in Microsoft, and they were a critical part of doing the technology assessments and the building of the technology plan, the implementation plans. A critical component of this is a desire to, how can we make our caseworkers, how can we make any of our workers, but especially the caseworkers, mobile? How can we untether them from devices on the desk and give them the ability to be out there in the field doing the work they need to do safely and securely, and have the information they need and be able to share information they need on an immediate basis, not needing to go back to the office and be tethered to that terminal. So Motorola was a critical component of that, and between Motorola and Microsoft, we're building the overall implementation technology plan. Joan Bosworth, who we've heard from yesterday, and was a key presenter and wealth of information across many states, as well as being a lawyer, led the effort on confidentiality and came up with all the recommendations of how we can take Montgomery County to a place so that confidentiality, again, as she said, as she shared with me and given me guidance all the time, is how do you make it an enabler, not a disabler or a barrier? Marianne Emsweiler in the back, she provided the lead on the organizational readiness assessment and all the issues of studying the organization and what does Joe and his team need to do from an organizational standpoint in order to get on this journey and move forward, looking at all the components of what's going on. From a business process standpoint, we used R&R Consulting, and AV is sitting there representing R&R, and he was part of the team, he and Samo, and provided us support from a business process standpoint. Gretchen and Betty, they're still here. They like they're doing today, they provided us the guidance on the change vision and the facilitation on the 2-day change vision map, and created not only the interoperability roadmap, but the change vision map as well. And we're an integral part of that team. And last but not least, Michelle Collins, who sits in the back, she was part of the project management team. If nothing else, she kept me in line as Joe and I would go off and have our conversations, and I'd go back to her, and she'd get me back on the path and say, no, this is where we got to go, and this is the schedule we got to follow, and these are the things we got to do. So we are at the final end of it. A critical component of this has been continual discussions with the state, because many of whether it be the processes or whether it be the technology is linking to how it fits in with the state, and how we can capitalize and deal with shared services. Ricard mentioned earlier, shared services model. That's very much a model also of how a county could partner with the state and deal with shared services so that each county doesn't build their own little infrastructure, their own little processes to become silo into itself, distant from the state, and yet all the information has to flow between the county and the state as well. So let me stop here and let me turn it over to Scott and let him finish the story from the state perspective. Thank you.
I appreciate the opportunity to be with you today. I wasn't quite sure after I got the call that said Richard wasn't going to be here last week, and then last night got the message that Joe wasn't going to be here. I'm not sure what that meant in terms of my perspective, but I was really depending on their comments. So I've done some reshuffling, and I have a few ideas I just want to present to you. I appreciate Stewards of Change inviting me to be here. I like both those words. I got into public service because I want to change the world. And I still feel that a little bit, sometimes a little jaded sometimes, but by and large, I'm still in it because I want to change the world. And a part of that has to do with a notion that was given to me as a young boy from my father, who's been in public administration all his life and taught it, that public administration is a stewardship. It's something that's important for us to help our community, so stewardship's an important notion for me. And I'll talk later about change. I think if there's one constant, there's change, and there's some important things we need to deal with that. I want to talk to you from a couple of different perspectives, and maybe those perspectives will give you sort of a little bit of history of me and where I come from on this. The first perspective, I think, and I share that with the other CIO, is I'm a technology leader with no formal technology background. I've been in technology for quite a long time. So I got into technology because I knew that it could help me do what I wanted to do. I had discrete policy objectives that I wanted to accomplish, and I knew technology would help me get there. And I don't lose that as we go down this road. It goes back to that public service thing. We want to get the job done, and technology helps us get there. So I come from that perspective, and really that technology can be a driver of public policy solutions, that we need to go there. The other perspective that I come here from is as a former state-level IT director for a smaller state, Virginia, and now as the deputy CIO for the fifth largest state, Pennsylvania. That state-level perspective, bigger than Health and Human Services, recognizing the cross organizations. I want to talk a little bit about that as we come down the road. I also have spent my fair share of time in the private sector, at least responding, always related to government, but in the private sector, and I think that's an important perspective. And over the last 7 or 8 years before taking this job, I worked in the court system for the National Center for State Courts. And specifically, I worked on integrated justice issues, sharing information across the state, local, and federal entities in the justice side, representing the chief justices around the country. I'll tell you that one of my frustrations when I was in that job was that I was able to do a lot of integrated justice work with the criminal side. I wasn't able to do as much with the health and human service programs, with child support enforcement and child welfare. Now, we did do some good things. National Center for State Courts, we were able to put some exchanges together on child support enforcement, which is now, it was talked about, the family services domain within NEAM, and I'll talk about that in a little bit. And we're moving in the child welfare space. But I saw a huge opportunity there, and that's frankly why I switched sides and came to Pennsylvania to deal with health IT and health and human services, because I think there's a huge opportunity to cross those gaps, to cross the bridge between the various aspects of government and to ultimately meet the service responsibilities that are ours. So I think that's important. I am relatively new to health and human services. there's a lot to learn. I hope that my outside perspective can provide some insights as well. And I look forward to working with you as we learn through those things. I do have an obligation to tell you a little bit about DPW, the Department of Public Welfare, and Richard's responsibilities. DPW is one of my agencies that reports to me, so I'll give it a shot. What I want to do is break my discussion real quickly about state-level perspective and then a DPW perspective, and try to tie the things together. In the Commonwealth of Pennsylvania, we've been doing a lot of integration efforts for a very long time. We had an ERP before most states had an ERP installed, and have been going down that road for some time. We're in the process, well down the process of consolidating our agencies into a centralized IT organization. In fact, that's why I'm here. There is a state CIO and there are 4 deputy CIOs. Each deputy is responsible for a community of practice. That's our term for it, special interest group. There's a public safety community of practice, a health and human service practice, an environmental practice, and a general government operations practice. So I have 12 agencies where the CIOs for those agencies report directly to me and have a dotted line relationship to their agencies. And those 12 agencies are all the agencies you've been talking about, including the Department of Education, including the Department of Military and Veterans Affairs, including the Department of Agriculture, and it's overlapping, and there are some key things, but I not only have to worry about dealing with our veterans in their veterans home from a medical standpoint, but deployment operations and those kind of things. So, but I'll tell you, one of my frustrations as I've gone through that is in the Department of Agriculture, I can track a cow all the way from birth to the end. I can't do that in the child welfare space, and that's a frustration for me, and something we need to work on a little bit as we go down that road. So we've been consolidating for some time now, and I hope it's been smart consolidation because we haven't taken everybody and ripped them out of their agencies and thrown them into the central IT shop. We take a look at each agency. We determine if they need to come in. If they do, we bring them in. Sometimes we only bring in their technology infrastructure, the servers, the processing stuff. We leave the application development where it's at, depending on the programs and how it's put together. And the third model we have is that we'll pick a lead agency within our communities of practice who provides the technology support for the other agencies. So in my organization, the Department of Public Welfare, which is the 900-pound gorilla, also provides the technology support for our Department of Insurance, which is where our CHIP program lies, and also provides the technology support for our Department of Aging and long-term living. The organizations stay separate. They're separate organizations, but we've integrated the IT, and DPW provides that support. The CIOs from each of those organizations report to me, and I have relationships with the agency heads and the chief deputies to make sure that their needs are still met and that everything continues to be done. But I think it's a smart centralization that allows us to do it, and a recognition that centralization isn't always the way it needs to be done. Sometimes you distribute it, sometimes you centralize it. You got to do it the way that makes sense to make it all work. It's not to say that we've got it all figured out, but we've actually done quite a bit, I think, to bring us together and do some thinking. And I'm able to bring my CIOs together and talk about these issues. How does Department of Health talk to Department of Public Welfare? How do we use the same EVT systems, which we aren't right now? How do we pull these things together in a way that makes a lot of sense? There are frustrations, and frankly, many of those frustrations have to do with what Rick was talking about earlier with the federal funding silos and some of the other things. we need to work ourselves around some of those things. I want to talk real quick about DPW, and there are two things I want to mention. We have an IT services contract that's going to be released shortly, of an RFP. Some of the people here have talked to me about it, so I know that it's out there. We put a draft of the request out. It's really a good story, a good opportunity, because a number of years ago, the decision was made to consolidate all the support for all of our major stovepipe systems into a single contract with a single vendor. And you say, is that a good thing? I don't know, but it made contract management simple. Okay? Big behemoth contract. Over the last little bit, we've gotten a lot of criticism for that contract, and I think rightfully so. But while that contract was in play, and it's still in play, we took the step to say, okay, you're now running all our major systems. Help us break them down and identify key services that cross all of these stovepipe applications. And if we can develop these key services, then next time the new change comes in, doesn't matter which program stovepipe, we'll just leverage what exists. So we've begun that process. We have a master client index, a master patient index. We have a number of key centralized services that support all of our programs across those various things. Now, right now, our procurement is to break that up, okay? So we brought it all together, now we're breaking it up. And we've got the opportunity, because we've defined those services, to move from an integrated approach to a best-of-breed approach and bring in vendors who know child welfare, vendors that know child support enforcement, vendors that know these things to help us down that road, and still create the interoperability that we need at the systems level and at the service levels to accomplish what we want to do. So I think it's a huge opportunity. One of the things that we just did is we added, I think I can say this, well, I'm going to say it anyways, we added child welfare to this procurement, that also gives us some opportunities, because we can continue to integrate many of these things. That's coming out here in a little bit. I'm looking forward to a much more competitive environment. I'm looking forward to much more innovation out of the vendors that are ultimately selected, and an opportunity to push the types of distributed architectures the way we want to push those architectures in an important way. So child welfare, as many know, we aren't necessarily, we don't have a SACWIS, and sometimes we get slapped on the wrist for not having a SACWIS, sometimes slapped in the pocketbook. We are working, we've just finished our feasibility study and have identified our roadmap for moving out. We are doing a distributed approach where individual counties will be able to run their systems. While they're running their systems, a few select systems, we're going to build the state structure, and we're going to communicate across from the county systems to the state system, so that we can tie those links. It's a federated, a distributed environment. This, for me, is where you mentioned NEAM. This, for me, is where NEAM comes into play. NEAM is the National Information Exchange Model. I came from the justice space. That's actually all I did for many, many years, building that model and pushing it out and trying to put it together. The family services domain was put out. That was specifically set out for child support enforcement. I had a vendor do some work for me, taking a look at that domain and saying, how does that work for the broader child welfare and health and human services space? And looking at the child welfare space, which it wasn't designed for, but doing some analysis, we've identified a 90% reuse of that information model. So having the common vocabulary, the semantic interoperability is there. We've got it. We're not going to get much better than 90%. We've got the words. We've got the semantic pieces. What we're going to do with this contract is leverage that NEAM framework and try to expand the vocabularies to the rest of our program areas. So I think it's an opportunity to push towards interoperability at the data level and the business architecture level. All this has to do really is, for me, is related to service-oriented architecture. I'm just a huge fan of the approach. Many years ago, I wish I could remember his name. I can't. He's from Kansas, the criminal justice guy. He said it's all about working independently together, and that's really what we're talking about. We're not going to get on the same page technically, all the way across the board. We're not going to get on the same page in terms of budget cycles. Local government will always be different from state government, will always be different from federal government. All those differences are there. We don't have to get it all to be the same. We simply have to communicate across those lines. We need to work together. And we need to do it with common vocabularies, common business reference models. We need to build the architectures to allow us to do it and to adapt quickly. Many people here have talked about service-oriented architecture and these approaches to save money. I think it's a critical driver. We have to keep pitching that because that's the only way we're going to get this project going. But for me, it's about agility. It's about being able to adapt to change quickly, to implement new programs, to move quickly, not to worry about the organizational structure that's there because those are going to change and adjust, but to be able to adapt to what we're given and to deliver the services that we have to deliver. And I think we're at a critical juncture. The technology's there. There are models in other sectors, the justice sector and other places that we can adapt. There are models in the private sector that we can adapt so that we can work not just within health and human services, but as a state CIO, I don't want to deal with 10 different architectures. Maybe I have to deal with 3, but I want a couple so that we can achieve all the efficiencies we can. I appreciate you being here and dealing with this most important issue. And I look forward to Pennsylvania playing a key role as we go down that. Thank you.
All right, so I'm glad we got Neem there. So the only other thing that I've come up with, and do you guys have any knowledge or experience with HL7?
Sure.
The health is supposed to be the international standard for that. And is that a data reference model also, or is that an architecture? And how can we leverage that? It seems like that's been in the medical community for a number of years to integrate with these other models and references.
I'm going to give you a NEAM-biased answer to that, okay? One of the key premises to building NEAM is the recognition that we'd never have all of the data models stuck into one single model. There are always going to be experts in geospatial. They have their own framework. Some of the HL7 vocabularies and transactions are there and well established, can be used. What NEAM allows us to do is to wrap those standards into a consistent information model. So we can take the existing standards, and as a point of reference, the comment was we could adapt really quickly to the budget reporting requirements. Those were NEAM-based requirements. And the reason why we were able to put those together so quickly is because the framework was already developed, and it just so happened that Shemendra Paul, who helped us do it at the federal justice level, switched over to OMB to push it that level. We can take those discipline-specific vocabularies, whether they're accord from the standards bodies or HL7 or the geospatial community, and we can incorporate those into a consistent information model that's necessary for us to do our job.
My question is for either Montgomery or Pennsylvania, but I'm wondering what role, for example, the different departments had in this process, particularly with, there's a lot of pressure towards accreditation, particularly of public health or health departments. And in addition to that, have you also considered building in, or maybe you've already done this, I didn't hear, quality measures and planning for evaluation?
Well, I'll answer for Pennsylvania, and then maybe Uma can answer for Maryland. let's see, how did we deal with all the different departments? We focused on some of the departments within Joe, even though the stakeholders included all of them. We engaged at the base working level all the way to the top leadership, for example, of children and youth in the business process, in the discussions of confidentiality in the survey. So I don't know we ever got into issues accreditation as an example, but we engaged the entire organization in the discussions, whether they be individual discussions, group discussions, breakout process discussions. All of those, Joe and his organization gave us basically free run to the entire organization. And all the stakeholders they touched, like I said, from providers to courts to educators and so on. Your other question? Within our report, we have a model, and I should say models, where we look at data integrity. We also look at reporting and measurements. Those are all components of what we're building as the roadmap and recommendation, the recommendations in the overall roadmap. That's to me, that's a standard component of any rollout on implementation. Necessary measurements, evaluation, tools, various different, measurement plans. One of the things, I guess, an observation is we don't see a lot of what we call data-driven decision making, because either the data is collected but not used, or it's collected but not trusted, or in some cases it's not collected. I mean, it's a whole plethora of problems. So that's a critical component to everything that we look at, is how to collect that data and then how to properly use that data. Uma?
Couple of different responses. One, because we're an integrated department, that was an easier conversation for us cross-enterprise. A lot of the work we did was both cross-functional, cross-classification, so we had different levels of people. So we were pretty wide in terms of pulling the folks, and then the leadership was on board, so that made it easy. The second piece of it, we have CARF accreditation on our substance abuse side. We do have council on accreditation for our social service programs, so accreditation is really important. One of the things we did was, each of them has a quality component, or a quality council, PQI, something that's required, and we pulled it centrally. We actually created a couple of different things. For the county executive and for external reporting, we had to come up with some metrics. And we built some qualitative metrics, and we built the usual sets of quantitative metrics. And our quality service review tool is a big part of our qualitative metrics, as is customer satisfaction, and then the usual that the state needs, the error rates and things like that we measure. So different programs have different metrics, but we have department-wide 14 metrics that we actually report on, measure on, that are both qualitative and speak to quantity. And then we built this department-wide, what we call our Performance and Quality Council, and we actually discuss our performance trends. We built a data team that was cross-functional, cross-enterprise as a result of this work. So it's actually, it didn't make sense for us to have all these accreditation efforts in the department, and each of them have their own quality requirements, and so we just figured it was a good time to build a more central operation around it. So that's what we did.
Yeah, related to that question, I wanted to ask Uma and you were both Montgomery County in Pennsylvania, the question about the accreditation tweaks it for me in a different way. The question of how you've rolled out your initiatives in engaging the providers. I know, Uma, you referenced having engaged your nonprofit providers in the community, and I'm wanting to know a little bit more about how that has worked for you, and how and when you brought them to the table. What has that dialogue been a little bit like?
I'll just start talking. I think the room's small enough. People can hear me. I'll stand up. A couple of different things. We have a very strong provider community in the county, and
one of the things we did a couple years ago, we're not a performance-based contracting environment, but we wanted to move in that direction. And so we found that we had several in-home aid contracts that looked exactly the same, or homeless shelter contracts. And So what we did was we pulled clusters of providers, and we picked our 2 quality measures, beneficial impact and customer service. And we had these clusters of providers pick 2 measures that they could agree on across providers. And so they picked a beneficial impact performance measure and a customer service performance measure. And as we are bringing we can't do it on existing contracts because it's changing scope. But as new contracts are coming online or we're renewing, contracts are ending and we're starting new contracts or bidding things out, we're putting these standard measures. So we anticipate that in the next 3 years, all of our contracts will have the customer satisfaction and the beneficial impact measure. So that's one way of sort of addressing the quality issue that we began the work on. The second piece of it is we started CRM 311, and it built into it a referral mechanism for our providers. And we've had a interoperable web-based information referral system that any consumer can access called Info Montgomery. That started the conversation of engaging the providers in the whole idea of at least doing referrals online or by phone or by paper. And that was the door that has opened, and we have much, much more work to do on this. But our providers want to be part of the care team, and they want to have a place at the table. We have not quite we've built our whole confidentiality protocol for cross-enterprise. We want to take it to the next level, but we want to get it right inside the house first. And so that's where we're focusing, but our goal is to build it for the next tier. So if you think of concentric circles, that's the next circle we want to tackle, but we're not there yet.
I'd ask Deborah Wolf, who is a resident of Montgomery County, has been familiar with there. I think any answer I could give would be speculation. So, Debbie, if you don't mind.
The Montgomery County, Pennsylvania project has not been rolled out yet. It's still in its planning phase. But the provider community has been included from the beginning of that. In the visioning process that stewards did, they included stakeholders from the provider community, including representatives of private agencies, local foundations, medical providers, homeless service providers, and engaged them in the visioning process as well as buying them in to the vision. And there really was incredible response from the provider community, a real buy-in to this potential process. The other thing is that the Child Welfare Agency's Citizen Advisory Committee has been involved and educated through before the process began, when it was a concept, all the way through to this point. So they're very much in step with it. I think a long-term, which we haven't talked about, a long-term projection for this or hope for this is also to bring on the provider agencies as part of the information sharing so that you can look, and I loved how, the talk about being able to make electronic referrals. I mean, God, what a dream. Being able to also monitor compliance. One of our biggest concerns from the field center is that families refer to communities and services all the time, but there's no loop back until you get to court and find out, well, did they go to parent education classes or not? So being able to utilize the technology to monitor utilization of services on an ongoing basis is another kind of down the road projection.
I have one question I want to just pose quickly to any of our other partners, not the partners in the room, but the other parts of the continuum in the room, which is as you listen to the connectivity from the private provider community to the service delivery at the county level to the state, how do federal agencies play in that? And what perspective do you have in terms of facilitating, supporting that kind of work that brings it all the way down? And is that part of your vision as we move forward in a lot of the innovation that's going on? So just throw that out there. Yeah.
When you picture the patient-centered medical home, I mean, this is where this all kind of folds into. When I picture a client coming in to the system, whether it coming to the health center or coming through the social services, one entry, one enrollment. When we pictured all those silos, I think the presenter presented all those silos, but the business processes, enrollment, intake, enrollment, eligibility screen, all those processes should be similar throughout all those different silos. So, when I picture when we put out our grant applications, these kinds of things need to be incorporated.
Actually, just to wrap up, one thing that Gerry didn't mention, which is really directly connected to even what Scott said, I think we're talking about semantics, nomenclature, and all those things. One of the key things, I think, from just being on the Stewards of Change team that we did, which was quite interesting, unique, and valuable, was the best practices part. Not only did we look at the client's processes and we look at the external and internal stakeholders and all those things and constantly think about what is the wider impact, but in fact, that was a key part of what we did, which was we involved the different counties. And I think I heard you say earlier about, you've got all these different CIOs building their own architectures. Well, that was the one thing I think we've always thought about is we didn't want to be in that kind of silo where we're just clustered in this group and we're working with one client and thinking that way. So that was one of our key deliverables, I have to say, which was really the best practices piece.
I would say that it's not a primary focus of ours as we move ahead, but the one thing that we would like to make sure of is that nothing we do precludes this activity. Our primary focus, our mandates are relatively clear, and perhaps with healthcare reform, more may be written in. But right now, we have job one to do. The biggest thing I think our biggest additive value will be to make sure that we don't make a step either through our standards or certification or any of our rulemaking process that will preclude it or make this even harder for you to do. Because once the infrastructure is built out, I think we see a lot of other opportunities. But first, we are just focused on job one, so we just want to make sure we don't step in your way.